Hello, I'm Dr. Ryan Flannery. I'm a family physician at WCHC's Family Medicine Clinic. I'm here today to talk to you about COVID vaccines and the recent changes that have happened. We now have 3 available COVID vaccines to help protect people from COVID infections. Recently, the Pfizer vaccine was approved and extended to be used in children ages 12 to 15. This vaccine is the current only vaccine that's available for this age group. The current data that we have on the Pfizer vaccine, more than 150 million doses have been already given worldwide. In this study where they looked at children, 2,600 participants were enrolled ages 12 to 15, and the results of this study showed a 1.5 times stronger immune reaction in this age group than compared to adults. The most common side effects seen in kids with this vaccine include arm pain, pain at the arm at the site of the injection. There was no reported allergic reactions to this vaccine in kids like we saw rarely with adults. And they had some modest rates of mild systemic symptoms 12 to 36 hours after the vaccine was given, which included symptoms like muscle aches, fatigue, and headaches. In this group, there was no reported COVID cases in any of the vaccinated children in this age group. So what does that say? That says that this vaccine from Pfizer is extremely powerful and extremely protective to protect children in this age group from COVID-19. So why are we thinking about vaccinating children now? Well, this age group right now seems to be the age group that's having the highest rate of COVID infections right now. Most children have COVID infections, they recover without any difficulties or problems. However, we still see cases of children getting hospitalized or dying from complications associated with COVID-19. And upwards to 50% of these children who have COVID-19 can have lingering symptoms that may take weeks to months to recover. That can include persistent fatigue, persistent cough and shortness of breath, headaches, or even other stomach concerns. We also know that in our community, the more COVID-19 infections that are around, the greater likelihood that this disease is going to continue to spread and continue to cause more illness in the community at large. So to alleviate some concerns, I think I want to address some of the myths and questions that people have asked me about the COVID vaccines currently. This is completely false. The COVID vaccine stimulates a reaction right at the injection site in your arm. It uses cells in that area, including the lymph nodes in that area, to create a protein in the body to cause an immune response. And this immune response is what gives you protection from developing COVID infections in the future. Your body is very smart, and it only mounts this limited immune response at that area. It doesn't have any interference with any other organ systems in the body. It has no bearing on hormone levels and has no effects on reproductive organs. I've encouraged everyone to get this vaccine, including my children and family members. There is a difference between natural immunity, which is the immunity you create when you get sick with an illness like COVID-19, and vaccine-induced immunity, like the immunity that you get when you respond to a vaccination. So studies have been done right now looking at those 2 classifications. And what we found is that people that develop natural immunity from recovering from COVID-19, there are a subset of people that don't create a great immune response in that category, and that immune response doesn't seem to last very long. And if you look in comparison to what we've studied and looked at now with people that have gotten the vaccination for COVID-19, their immunity is much more robust, and it seems to last much longer intervals, and it seems to be the same type of effect in each individual that gets the vaccine. So yes, you'll get some immunity if you recover from COVID-19, but to ensure that you have the best type of immunity that seems to last the longest, getting a vaccine to induce that immunity is your best answer. So I've been counseling patients that even if they've had COVID in the past, getting a vaccine would only boost your immunity and ensure that you have better immunity going forward that hopefully is going to last longer than the initial immunity that you got from recovering from COVID-19. The science behind the vaccines has been around for 3 to 4 decades. We've known how the cells work, and we've just been able to harness that knowledge in a vaccination. The scientists who have been studying other disease entities for the last 10 years, including SARS and other respiratory illnesses, already had a head start in creating some of these vaccinations, but they weren't put into medical practice yet. When the pandemic hit, they just took the knowledge they learned and started to move forward with creating a vaccine to protect us against COVID-19. What governments did during the pandemic is actually put funding directly towards development of the vaccine, as well as removing regulatory guidelines and red tape, so to speak, to allow these vaccines to be looked at and studied in a very quick period of time. It also allowed studies to be ongoing simultaneously. So instead of starting at the beginning and going through each step of the way, they were able to do multiple steps at the same time. The studies of the vaccine themselves are still very rigorous and are the same exact studies we've done on any other vaccination that's been approved in the past. It happened fast because we had funding it, and it allowed it to go forward as quickly as possible, but still using the very vigorous trials that they've used in the past for other vaccines. No, you cannot get COVID-19 from these vaccines. These vaccines don't have live virus in them, and they do not cause any illness whatsoever. It's fooling your body to create a protein to mount an immune response to give you protection. It's 5 steps away from getting the infection, so you will not get COVID-19 from these vaccines. The side effects from these vaccines are very mild and are not dangerous whatsoever. The symptoms that people get from side effects last maybe 24 to 36 hours. But remember, vaccinations are supposed to cause a reaction in your body. That's what you want. You want your body to create an immune response to give you armor to protect yourself from future infections. So most vaccines that we use today across all age groups create some type of reaction, like the COVID-19 vaccine does as well. These symptoms confirm that your body is doing something to help you give immunity. The side effects are only a nuisance. It is impossible for these COVID vaccines to do anything to your body like changing your DNA. The science shows that it's impossible to do this with any other types of medical treatments, including vaccines and medications. So this is absolutely false. These vaccines have no dangerous substances or chemicals in them. Rare instances of allergic reactions have been reported with adults, but this is extremely rare. Children between the ages of 12 and 15 have not shown any reported cases of severe allergic reaction. These vaccines are the key to getting through this pandemic and getting our lives back to normal around the world. Over the last few weeks, our numbers of COVID infection in our communities have been dropping, and that is great. Infections with COVID-19, I kind of think about it as like a wildfire that's burning person to person and causing illness. And currently, we've been trying to smother out this wildfire by preventing spread from this disease from person to person. Our efforts to try to prevent this wildfire spread has included mask use. It's to prevent spreading germs from person to person. We've been trying to do social distancing where we're staying away from others to prevent spread. We've increased cleaning to try to prevent germs from being passed from person to person. But recently we've had changes now at the state, business, and school levels where we're no longer mandating mask use or social distancing. People are now feeling more comfortable out in social situations. The way I see it, vaccinations are our greatest option right now to give people individual protection from getting sick from COVID-19. As a physician, a parent, an uncle, a son, a community member, I'm recommending everyone get vaccinated so that they can protect themselves from COVID-19 and prevent others in our community from getting sick from this illness. WCHC will be hosting a Pfizer vaccine clinic specifically for kids ages 12 to 18 on Wednesday, May 26th from 2 to 6 p.m. Schedule your appointment at the website link listed below, or you can visit WCHC.org for more information. Thanks.